Good afternoon, everybody, and welcome to the National Council Membership Update. I'm Ed Woods. I'm the National Council Board Chair, and I want to take a minute and say a few things before we get started this afternoon. It's been a great year, 2024, for the National Council. The National Council has accomplished so much in the past year. They've done a great job of getting involved in many of the administration decisions and administrative decisions uh, at a very high level here in Washington, D.C. Uh, our staff and our board has been very engaged in working towards making sure legislation is passed that helps you in the job that you do, where you out in the field and you take care of our consumers. I also wanted to talk a little bit about 2025. 2025 is going to be a different kind of year for all of us. For me as well, I have uh, really enjoyed being chair of this board, but my term ends in 2025. So this will be the last membership meeting that I'll be addressing. But I just want to leave by saying this, that this will be a consequential year for our public mental health system. All the work that you all do to take care of our consumers will all come down to many of the battles that we're going to have over the next year. Chuck and his staff and our great board has already been engaged with the administration, and they've already been engaged with the oncoming administration and the transition team about how best that we can handle and look forward to taking care of our consumers that you all see every day. This is an important year for you to be a member of the National Council. Chuck has to go up on Capitol Hill, and when he's up there, there is nothing more powerful than to have you be standing behind him as members and walk into an office of an elected official and say, hey, I represent the membership of the National Council for Mental Well-Being. That power and that voice really resonates up on Capitol Hill, and Chuck and his staff do a great job of working on that and making sure that they understand the voice that you all have out in the field. After all, you guys are the ones that look at our consumers every day. You guys are the ones that see them at their best, their worst, when they're homeless, when they're hungry, when they're not getting good medical care, when they're not getting dental care, when their families are giving up on them. You all look at them right in the eyes every single day. And we get that, and we never forget that when we do this work here at the National Council. So, without further ado, I'd like to introduce our President and CEO of the National Council, Chuck Engola.
Thank you, Ed. And Ed, maybe before I say anything, I'll just thank you for your leadership. I don't know that folks know that you've been on your local mental health authority board for over 35 years, fueled by your family's contact with the mental health system, your brother's diagnosis, and you've given your life really to try to help make our systems better for people who need care. We're so grateful for your lifetime of dedication and also for your service to the National Council. You've been an incredible, passionate chair for the National Council as we navigate these difficult times. And just we're so grateful to you. So, since this is your last meeting, I wanted to make sure that I publicly had a chance to thank you. But you're going to be chair through June. We're not losing you yet, but I just want to say thank you.
Thank you, Chuck. And I appreciate that. And you're right. Sometimes you never know what's going to drive you to this work, but it was a family member that drove me there. And I've continued this work. And I just found out that, it really is important for those who are suffering from mental illness and substance use disorders to have a voice and to be that voice for them. So thank you.
Thank you. And welcome, everyone. Thank you. Appreciate your presence today as we just spend a little time thinking about reflecting on the past year. We'll do a little bit of thinking about the year to come and just try to give you some sense of what National Council has been focusing on. Really appreciate it. Michael, we go to the next slide. This has been a tremendous year for the National Council. Ed talked about, oh, I guess this one has, yeah, about the things that the National Council accomplishes. But, National Council is all of us. What we accomplish is, because of the strength of our membership, the connection that you all have to your communities, to your elected officials, and to the commitment that the board members who come from every part of this country bring, the time, perspective, and energy that they bring. This last year, the National Council Board spent finalizing a strategic plan, and I'm showing you the high level overview of that strategic plan that will guide us for the next 5 years. And I think this was probably the most in-depth strategic planning process that I've experienced at the National Council. I've only been here for 19 years, but in those 19 years, probably the most thorough process, not just developing these goals, but the underlying strategies and metrics to help all of us understand where we are on this journey to trying to impact public policy, strengthening our membership, making appreciable differences in workforce retention, recruitment, development, making sure that we have programs that serve you and helping you may be effective in your communities, and making sure that people understand that mental well-being is an essential component of overall health and well-being. So these are our high-level goals. I think you will see that if you click on the strategic plan, you see that the underlying strategies really speak to the kind of concrete things that we intend to do to support you. And I would hope that you would see yourself in those. How we're going to get there, the National Council realizes that we need to continue to develop and grow as an organization. And it's been an incredible ride. And those of you who are leaders in your own organizations know how much time and attention it takes to building culture, to supporting leadership development, talent management, all those kinds of things. And so National Council is no different. We're continuing to look at ways to strengthen and build our workforce, and making sure that we reduce any obstacle internally that prevents us from focusing on delivering for you, our members. I always say to our staff that our job is to try to make your jobs easier. And that is one of the things that we continue to focus on. Next slide. So, National Council, certainly we engage in public policy, and we'll spend some time talking about that. But again, I think you'll be comforted to know that everything we do is focused on you. In addition to our public policy work, we have a number of programs and initiatives that are designed to support National Council members, everything from the work we do on integrated care. I was at a meeting this week at the White House, actually, at the old executive office building, talking about performance metrics for substance use disorder. And I was in a subgroup focused on integrated care. And I don't know if it made me feel old or what, but I talked about the fact that the National Council issued our first paper on integrated care in 2005. And we have continued to not just be a thought leader, but to try to support organizations, both primary care and specialty organizations, as they pay attention to the full needs of people that they serve. We certainly do an awful lot of work now in helping organizations on their journey to becoming a certified community behavioral health center. with grant monies that we have from SAMHSA, as well as internal investments, really trying to help both states and providers take advantage of this once in a lifetime opportunity we have to really fundamentally change the way care is organized, financed, and delivered in this country. If you think about the arc of change in our mental health system, the first really large change happened with Dorothea Dix and her moral treatment approach, which led to the creation of state psychiatric hospitals. Then in 1963, the passage of the Community Mental Health Center Act. And I really see CCBHCs as the next wave in that evolution. We now have 20 states that have implemented CCBHCs. We expect planning grants to be awarded to at least another 10 states in the coming weeks. And I think we have continued opportunities both to refine the model, to extend it in states so that it is statewide, and to think about the way that CCBHCs connect to crisis care, serve children, and also people with substance use disorders. And speaking of substance use disorders, this last year, National Council created a new department focused on substance use disorders. And one of the things that Phil and Alexandra have done is really try to coordinate activities across the National Council. We've released some really cool products. If you haven't seen it, the project we did in coordination with CDC called Getting Candid, which addresses youth substance use prevention. Another campaign that we did called Start with Hope, which is really targeting men in certain communities to encourage them to seek treatment and try to achieve recovery, and a series of fact sheets that we did in collaboration with the National Association of Addiction Treatment Providers and CARF, really trying to think about as treatment systems, how do we think about and respond to return to use, and think about, put it in the context of chronic illness. So those are some of the things that we've been up to this year. And I couldn't let this go without saying that also this year, mental health first aid surpassed training 4 million people in that program. I think this is so important. If we recognize that we have a treatment gap, more people need treatment than receive it. Part of that treatment gap is related to people's willingness to seek treatment. And I think programs like Mental Health First Aid help build awareness, knowledge, and trust in the mental health system for people and substance use system for people wanting to seek treatment. That's why that program is so important to us. You know, Ed talked about 2025 being a consequential year for the National Council. I just want to reflect a little bit that we've had some very good years recently in terms of policy changes that support access and quality of care. You know, I probably should have retired in 2022 after every single piece of legislation that we talked about on Hill Day was some action happened where it became law. That doesn't happen very often. Certainly, I would encourage all of you to participate in Hill Day. It's only going to become more important. That's our opportunity for people in Washington to hear from people and back home about what you're experiencing, what your needs are. But you know, if I think about the last few years, not only have we created a framework for national expansion of CCBHCs, but we've also created policy that Congress has created policy to, as it says, mainstream addiction treatment, that mental health and substance use care should happen everywhere. that we need to reduce as many barriers as possible for people receiving care. And, the Mental Health Access Improvement Act, that was the bill that allows marriage and family therapists and licensed professional counselors to bill Medicare. That was a piece of legislation we were working on for 25 years. It was such an incredible feeling of accomplishment when that finally passed. And I think it's all a symptom of the level of support, awareness, and commitment that people have to mental illness and substance use. People in Congress have. If COVID did anything, it helped people realize that these illnesses really they're real, they're common, they're treatable, and that we need to make changes so that more people can receive care. This last year, the current Congress, if you go to the next slide, Michael, the 118th Congress has been described by people who study these things as the least productive Congress in the history of the United States. But even in a year where not much has happened, some great things happened in terms of congressional direction to states around everything from residential substance use to access to Medicaid, as well as medications for opioid use disorder. And what I think is something that I wasn't sure we'd be able to pull off is getting the CCBHC definition added to Medicaid, added to the Medicaid statute as an optional benefit. This is the first time since the creation of the Medicaid program in 1965 that there is now a dedicated mental health and substance use benefit in the Medicaid program, something that we can build off of in other federal programs. It was a great feeling and certainly a great compliment to the other work that's been happening to expand the CCBHC demonstration project. So next slide. This is showing my age. Some of you might not know this Johnny Carson character, but for those of you too young to remember, Karnak the Magnificent, we'll try to predict the future a little bit. I think it's fair to say that we will likely have some challenges. And again, the lens by which the National Council views the work that we do in Washington is what do we engage in that will help expand access to treatment, improve quality of treatment, make sure that more people receive care. And that is then how we view the work of the National Council, whether that be defensive or offensive, in light of those priorities, to make sure that people can have more access to care. We are certainly, reading press reports, hearing from members of Congress that in order to extend the Trump tax cuts from the first Trump administration, they will likely be engaging in a legislative maneuver called budget reconciliation. And there's certainly potential in that and we see lots of press reports discussing the use of that vehicle as a way to make changes to the Medicaid program. And I think in this instance, the make changes would be to limit the program. We know the outsized role that Medicaid plays in financing care for people with mental illness and substance use disorders. We've engaged numerous times, unfortunately, both in the Deficit Reduction Act in 2005 to 2007, and then in the repeal and replace of Obamacare in 2017, working to protect the Medicaid program. We obviously will continue to monitor the situation and will, be ready to speak on the behalf of organizations who deliver care to low-income individuals who rely on Medicaid in order to try to ensure access. Number two, I do think also that we certainly have seen in this new DOGE committee and other comments, a desire to reduce federal discretionary spending. As you might know, discretionary spending at the federal level probably accounts for, I think it's around 35% of all federal spending, and that includes and discretionary spending includes all of the spending on the Department of Defense and our military, all those kinds of things. And so if you take out just the non-military part of the federal discretionary spending, we're more in the range of 17 or 18%. So it's a very small percent of federal spending, yet it plays an outsized role in financing substance use care in this country, from the SAPT block grant, other discretionary programs from SAMHSA, other federal agencies that subsidize work that you all do in your communities. Again, I think we're probably in the best shape we have been in a long time as a field in terms of awareness and commitment to our issues, to people who live with substance use disorders and mental illness. Yet, I do think if there are targets for overall reductions in discretionary spending, it would be hard to see how SAMHSA could be categorically exempt from those kinds of reductions. Obviously, time will tell as this plays out, but those are things that we are starting to be concerned about and plan for. And then, certainly there's a lot of discussion right now about reform of federal agencies. I think probably the one that brings the most kind of concern that we've heard about is the potential that's been talked about of merging NIDA and NIAAA, the agency that focuses on alcohol use disorders, as part of the larger reorganization of the National Institutes of Health. But there are certainly lots of discussions now about reform of other federal agencies. Have no idea how all of this will play out, how these different topics will interact with each other, and what overall effect that will have. But certainly, it is true that the National Council can help open doors and we can go do things. But what has the biggest impact is members of Congress hearing from their constituents. We hope that you are receiving our special newsletter, Road to the 119th Congress, which is following developments during this transition period that is published every other week. And hopefully you're also receiving our Friday Capitol Connector newsletter, which provides ongoing, timely updates about developments in Washington. Now, I go back just a second, Michael. I do want to say that not everything that we're anticipating next year is bad. We do think also there are opportunities potentially next year. We understand there's been a lot of interest over the last few years of loosening the IMD exclusion in the Medicaid program, making financing for residential mental health and or substance use services more available. A budget reconciliation process would also provide an opportunity for movement there. And we're also looking at the overall desire to reduce federal regulations. Does that present any opportunities for us in terms of reducing administrative burden experienced by community providers like yourselves? Earlier this year, our Medical Director Institute issued a position statement on treatment planning to reduce the amount of treatment planning that is required. That is certainly the kind of document that we will be using to advocate for reductions in federal oversight, federal data reporting, other oversight of behavioral health organizations that is burdensome. All right, on the next slide, I hope you have taken advantage of our Center for Workforce Solutions. Again, this is an initiative spearheaded by the National Council and done in conjunction with our colleagues at Health Management Associates and the College of Behavioral Health Leadership. Next slide. this is ongoing opportunities to look at all aspects of the workforce crisis and to try to develop solutions collectively. Um, we understand that the largest challenge you all are facing relates to workforce. We're looking at, legislatively at what we can do, and outside of the Center for Workforce Solutions, looking at other ways that we might be able to make appreciable contributions to solving the workforce crisis. Everything from trying to expand programs in high schools and middle schools to get people introduced in our industry, looking at ways that we can make professional education more cost effective through partnerships with academic institutions, the expansion of things like apprenticeship degrees, looking at alternative pathways to licensure, as well as examining topics like task sharing, which have mostly been developed and implemented in developing countries, of really training lay people to do some behavioral health interventions. Could that kind of training be used by case managers and others in our system to provide additional support and options? So we're taking a very wide approach to thinking about workforce. And again, happy to hear from you about things that you would like to see or ideas that you have. The rest of the slides just are other mental health first aid. I mentioned earlier about its importance, but the rest of the slides are different resources released by the National Council, just to give you a sense of the breadth and depth of the kinds of activities that we're engaged in. We'll be releasing our annual report in mid-January, and that will also provide you more detail about things that we've done over this last year. Michael, maybe could we just go to the last slide? I just wanted to end by talking about that little conference that we do every year called NatCon. We're going to be in the city of brotherly love in early May. We hope that some of you will have an opportunity to join us there. This is our opportunity not just to provide a forum for education and connection, but also to celebrate you. One of the explicit goals of NatCon is to celebrate you, our members, the work that you do every day. Ed talked about this at the top. We know how difficult it is. You do incredible work to help people reconnect with with themselves, to realize their potential, to achieve recovery. And anything that we can do to support you is what we want to do. And NatCon is one way that we do that. So we tried to make sure we had plenty of time here for questions, and look forward to hearing questions you might have. And just thank you for the work that you do every day in your communities.
We'll give folks a few seconds if they want to send in a question, but none so far, Chuck. That's a lot of praise for Ed so far.
Yeah. Well, I'll just say that I appreciate all of you being here today. And, I just want to remind you that my email address is chucki@thenationalcouncil. Always happy to hear from members and to be a support. So there's a question from Vera. What do you think will happen with Medicaid? And Vera, I don't know the exact answer to that question. We've not seen any specific legislative proposals yet. Again, just reading reading different press reports, as well as documents from think tanks. There's a particular think tank called the Paragon Institute that is very tied to the Trump administration that we've taken a look at. And Vera, certainly there's lots of ideas floating around. One of them is things like, returning to this idea of a block grant, or sometimes they call it a per capita cap. We've seen discussions of things like dealing with or reining in provider taxes and intergovernmental transfers. The Paragon Institute paper talks about reducing the federal floor in Medicaid. So right now, the least amount a state could receive in FMAP in federal participation for Medicaid is 50%. The Paragon Institute argues that that floor should be more flexible, and so quote unquote richer states might receive less federal monies. So those are the kinds of ideas that are being talked about, and then seeing what actually ends up in terms of legislative proposals is another thing. So I would just say, hang on, we shall see what comes. So there's a question here about getting the in-person visit requirements for Medicare delayed. I do think that is a real possibility. In the House, the new chair of the Energy and Commerce Committee, it would be Congressman Guthrie from Kentucky, who is on record as being a supporter of telehealth. I do think, from folks that we know in the broader telehealth community, they do think that there will be, probably some, the next Congress will be very favorable in terms of expanding telehealth. We shall see, but that is certainly a topic that many people have brought up. This question, Camilla, about what new programs are we seeking to develop in mental health first aid? I don't know the answer to that, but we will capture your contact information and we will put you in touch. We actually have a whole team at Mental Health First Aid that is looking at the curriculum and thinking about new products. And so I'm happy to put them in touch with you. I see there's a question from an anonymous attendee that says, I suspect even some Republican governors will push back against Medicaid block grants. I would say, from your lips to God's ears, I would hope that would be true. So I know in past years, the National Governors Association, which tries to work on consensus, has never been able to take a position on block grants. So I think that's a symptom of what a contentious issue this is amongst governors. All right, we'll hang out and see if there are any other questions. And as I said, you all know how to get a hold of me and the National Council. We just appreciate your dialing in today. We appreciate your membership in the National Council, your support of our work. As Ed said, we look forward to working with you next year as we interact with Congress. I hope all of you take some time to rest as we approach the end of the year. Whatever holidays that you celebrate, we hope that you celebrate them well. And just want to say thank you and look forward to seeing and talking to you at NatCon in May in Philadelphia. Thank you.